Assalamu alaikum and welcome back to Medicow on IQRA TV. I'm Rabina Mir talking to Dr. Raj, and we've been discussing and answering lots of your questions already around cosmetic interventions such as anti-wrinkle treatments and fillers. We're going to continue the conversation, Dr. Raj, because I know this is a hot topic at the minute, particularly because of the things that don't go well sometimes, and we want to make sure that our community stays safe, which is why we're running the programme.
Exactly.
Really. Can I just ask you, how big a business are we talking about? It seems like it's a massive business.
So like we touched on earlier, this is a business that seems that it's definitely not going to die down. In 2015, the UK aesthetics industry, kind of all these treatments that we're talking about privately, was worth about £3.5 billion.
That's a lot of money.
That was in 2015. In the last, and it's been increasing every year by about 4 or 5%. More patients are having treatments privately.
And I think we're getting we've got a call waiting at the minute. I think we're getting calls in because it is not just the hot topic, but it's about, there's lots of misunderstandings about it. So
Completely.
maybe if we can bring in our next caller and see where that takes us with the conversation, we can come
definitely,
back to
definitely.
that. Hello, caller, who's there?
Hi, it's Hannah calling from Newcastle.
Hello, Hannah.
My question is, I had lip filler done about 3 months ago by a beauty therapist.
Okay.
So I have now got a lump in lower left side of my lip.
Okay.
It appeared a few days ago and hasn't gone away. So I'm a bit worried about, could it be something serious?
Oh, well done for ringing in, Hannah. Let's just see what Raj
Thank you
says.
for calling in, Hannah. I appreciate your call.
Thank you.
So a lump in her lip after
So
the procedure.
you have a lump in your bottom left lip, did you say?
Yeah, bottom left side of my lip.
And how long has it been since you had your filler procedure?
3 months.
3 months ago. Okay.
Yeah.
But you said the lump came 2 days ago.
Lump only appeared a few days ago.
Yeah.
Okay.
Have you been back to see your practitioner who did your procedure, the beauty therapist?
But she said she shouldn't know what the lump is and I shouldn't worry. So
She said she didn't know what it was.
no, but it hurts and it's getting better and looks red in the mirror.
Okay, so it's red and painful.
Yeah.
Right. Okay. So those are really serious symptoms that would firstly make me slightly twitchy, that we need to make sure we rule out an infection. And this is probably one of the reasons why it's so important to make sure that you firstly know the risks of the procedure before it's done, but also also really importantly, you know the credentials of the person that's doing the procedure.
But it's too late to do that now.
It's too late to do that now.
How can we help
Hannah,
Hannah?
Did you say you're calling from Newcastle?
Yes.
Okay, fine. So what I'd advise you do is, from what it sounds like, there are many reasons why you can have a lump in a lip after having dermal filler procedures. There's things that are quite tame, and there's things that are a bit more serious. But if it's getting red and painful and getting bigger, then one of the things you have to rule out is an infection. There are other things like having something called a granuloma formation, which is basically like your own tissue forming an extra lump, which is quite benign, quite tame. It doesn't really mean anything. It can go down with a bit of, sometimes with some steroids it will calm down. But if it's an infection, you need a course of antibiotics.
Okay, so trip to the doctor.
So you need to take a trip, especially if it's a beauty therapist. They won't be able to prescribe anything for you, which is one of the reasons why you need to make sure you know who you're going for. But I'd definitely say you'd need to go to a GP and make sure that they have a look at your lip, do a full examination, take a full history, and maybe prescribe a course of some medication, preferably some antibiotics, but it may also be steroids if it's not infection that they think might be going on. Worst case scenario in these kind of situations, I'm not saying this is your case, Hannah, but I've known people had to go to theatre to have a surgical drainage of an infection if there's pus building up inside a lip.
Right. So it sounds like a trip to the doctor's important at this point, Hannah. So hopefully that's answered your question for you, and we hope you get better soon.
Thank you for your advice.
Thank you for calling in. I'm
Take
glad
care.
you could.
Bye-bye.
Okay, next caller. Hello, caller. Who's calling?
Hello, yes. I'd like to ask Dr. Sethi a question, please.
Okay, who's calling? And where
My name is Urmila.
Urmila?
Urmila.
Urmila. Hi,
okay.
Urmila.
Hi, Urmila. And where are you calling from?
I'm calling from London.
Okay, thank you for your call. And what's your question?
Okay, my question is that I've had cosmetic surgery before, and my husband is considering having anti-wrinkle injections. Is that possible? Is it? Do you do it on men at all?
Yeah, so we were just touching on this earlier, but thank you very much for your call, firstly, Irma. That's very kind for you to ring in. I appreciate your time. Anti-wrinkle treatments are getting more and more common, as we said, but also they're getting more common in both genders. So there is a massive, massive push in males to have these treatments done. In terms of any differences, the only difference is probably the dose. So in men, they tend to have slightly bigger musculature on the face, and they require slightly higher doses, which can mean, unfortunately, sometimes that it's more expensive for men to have the procedures because they have to weigh up the cost on the practitioner side. But in terms of actual benefit, it's exactly the same as female counterparts. So they can have the treatment; it'll last the same, normally about the same amount of time, but they normally require more to get a similar result, just because there's larger muscles that are involved.
This sounds like a good time to just check how we make the decisions on who to go to. So, Urmila, you said you've had a successful treatment. So how did you actually look into the background of the person you went to see, or is there something else you'd want to know about from Dr. Raj on that?
Yes, I did actually look up into it, and but that's my question for Dr. Sethi. But thank you very much for that. That's really cleared a lot of my query up. Thank you so much.
Thank you for calling.
Thank you for calling.
Bye for now.
Appreciate it. Bye.
So what tips would you give to our listeners about if they are going to go down that route?
So you need to make sure you know the credentials of the person that you're going to.
So what we're looking for?
So unfortunately in the UK there is this is a separate conversation in itself, but just to touch on it to make people aware, there is currently no law in the UK that regulates who can inject these treatments.
Right.
So anybody can inject anybody as long as they have their permission. So if you have my permission, you can inject me.
So does that mean they can buy it easily as well then?
Exactly. And these things are openly available on the internet, which is really serious. And unfortunately, this is a bit of an anomaly. It's a bit of a oddball, the UK. Most of the entire other Western part of the world, only doctors can perform these procedures. But here in the UK, there are many beauty therapists that are performing the procedures. I'm sure there are many very good beauty therapists that are performing very good procedures. Yes. But you need to be aware that if a complication does arise, like in the case of Hannah, you need to know that the person you've gone to knows what they're doing, has a sound medical background, and they have some medical training. So hence going to someone who is a doctor, nurse, dentist, or nurse prescriber or prescribing pharmacist, those are the people who are medically inclined. They know what they have been trained, but you got to check their training as well. Yeah. And make sure they're trained appropriately for the treatment they're providing.
So what risks are we taking then if people go to people like a beauty therapist who isn't got a medical background? And often these things happen through word of mouth.
Completely.
I've heard people have these parties where, they're having the treatments done.
They are phenomenally bad practice, because ultimately this is a really serious procedure, and to take it that lightly that you would have it at a party is just completely unethical and against practice. And any practitioner who's doing that is not worth their salt. It's really unsafe. Because if these things happen, you're basically, it's down to peer pressure. So if you have 5 people wanting to do a procedure and you really didn't actually really think you'd wanted it, you're more likely to have it done because 4 other people are having it done around you, which is not the way it should be. It should be a sole ethical decision based on what you want and what your practitioner thinks is in your best interest, and to come to a joint decision together.
But Raj, you and I both know that we live in a time where, the beauty industry, the models on display, Bollywood and Hollywood are all influencing, particularly our younger generation.
There's a big push.
Even my generation, I think, are being influenced by it still. Yeah. Not to look as young as you can, no matter how old you are. It's like we're against looking our natural age nowadays. Yeah. And so, without getting into judgments about that, we are going to have young people getting involved, or even older people getting involved in these practices. What I guess is important to know is what do you do if something goes wrong, apart from going to see your GP? Are those therapists in any way liable for those things?
So the therapist that's providing your, so when I say therapist, I don't mean beauty therapist. I'm sorry, I mean practitioner.
Practitioners,
So so someone who is medically inclined. Beauty therapists are performing these treatments, and they are normally insured to. That's another thing you have to check whether they've got insurance.
Okay, so that's another thing to check.
Yeah. So if they are insured to perform those procedures, then technically, it is legal that they are performing those procedures.
Because I'm thinking about Hannah and this lump, and she's gone back to this lady.
Yeah, and the lady's not been helpful.
She's not been helpful at all.
No, because she probably doesn't know what that lump means, and that's quite scary and that's dangerous.
Yeah.
So if you're in a situation where you've had a complication and you're stuck, and you've been to a practitioner and they don't know what they're doing, then I would say the best port of call is to at least try and find someone who does know, and that sometimes means going to a different practitioner who does have the credentials and has dealt with these complications. GPs are good, but they might not know what's going on, because they might not be able to, they might not have the experience in this aesthetics industry, in the separate, it's a kind of a separate kind of underbelly of the medical world, and they may not have all the experience, and they may make a wrong decision. Just because they're a doctor doesn't mean they can't make a mistake. I think it's really important to make sure that you go to someone who has some experience in what you're doing, and hopefully they can try and get to the bottom and give you if they can't help you, they can at least give you the right direction as to what might be the best way to go.
Point you in the right direction. Yeah. Okay. I'm really interested about what the ingredients are of these injections and fillers, and what we've talked about the anti-wrinkle treatment. Are the fillers something else?
Yeah, so anti-wrinkle treatments and fillers are completely separate.
Okay.
So anti-wrinkle treatments stop the nerve function, and they basically stop the muscles moving.
Yeah.
And by doing that, they reduce the fine line and wrinkles over the course of several weeks.
Yeah.
Fillers are something completely different, and fillers are basically, in the olden days, fillers were made with lots of weird and wonderful things that we don't use now, and we've kind of trialed and tested stuff that is useful and isn't useful. But most fillers nowadays tend to be not permanent; they tend to be temporary. Most last between 6 to 8 months. You can get ones that last longer, up to 24 months in some cases. They are slightly more expensive, and they are made up of an ingredient called, most of the ones we use are made up of an ingredient called hyaluronic acid, which is basically a purified chemical that's actually already present in our skin anyway.
Okay.
So this hyaluronic acid is present in our skin, and the reason we have it is it holds water to it.
Right.
It tracks water and it holds water, and it gives the skin
so
that we have.
It's a molecule.
So it gives it's a molecule, and it gives the skin its plumpness and its useful complexion and its hydration.
So where are they getting it from?
So
how do they produce it then?
So you naturally produce hyaluronic acid anyway in your body.
But if they're going to use a filler,
if you use a filler,
where's it coming from for them to use it?
So the fillers are produced by massive companies that basically have got big industrial units that have made processes where they can make this hyaluronic acid synthetically, so they can make it in factories.
Artificial.
But it's exactly the same. It's a very, very similar product to what you've already got in your face.
Okay, I thought you were going to tell me they had a whole factory of people stood there being
no,
having something got animals in there.
This is
Okay.
So this is it's all produced synthetically.
Yeah.
But those things are as close to what our actual skin is like as far as we can get it.
Do you consider them safe products?
I consider them safe in the right hands, I think, is probably the best way to say it. They are a safe product. Millions and millions of procedures are carried out each year, and lots of people have it successfully, and no complications arise. There are, however, complications that can arise, and those are the ones where you need to be really careful. So, for instance, Hannah's case, she had a lump. That's really common. If you have it just a few hours after your procedure, it's more likely that lump is something like a little blood clot. While they've been injecting, a little vessel has been hit and it's bled locally. That doesn't concern me. Something more serious is,
she said it was 3 months ago.
3 months ago, yeah. But so in her case, having it so later on, unfortunately, means that there is a risk until the filler actually gets naturally dissolved by your body. You don't need to get rid of it. You've naturally got little chemicals in your skin that will eradicate and destroy that filler over time. Which means if you wanted the same look again, you'd have to have a repeat treatment again. But oh my God,
we just talked about the fillers and how they come from synthetic points and they break down naturally.
In terms of complication wise, so in that case, it sounds like an infection. You can get other lumps. You can get swelling. You can end up with worst case scenario is you can end up with anaphylaxis, which is a whole body reaction to it, where you get tongue and throat swelling, and that can happen with anti-wrinkle injections as well. in terms of the possible worst case scenario, something I need to touch on to make sure people are aware that this can happen, even in the safest hands, with filler, there can be rare complications where filler can be injected into a blood vessel. So although we're injecting into the skin, everyone's anatomy is different and people don't follow a roadmap. Everyone's faces are different. And the blood vessels inside the face are tortuous, they wind around, and they're different in everybody, and they all connect. And if filler is injected into a vessel, into a vessel, unfortunately, if it blocks the vessel, it can be devastating. And if the filler blocks the vessel and blood can't get to where it needs to go, the area where the blood can't get to will die.
So how soon would somebody who'd had something like that done incorrectly pick up on that?
It could be within seconds of having the procedure.
Because of pain?
Because of pain. So you get pain, you get a white blanching area where the blood isn't getting to, and you notice that the blood isn't getting there.
Right.
But it could be that it's delayed. So sometimes it's actually a bit of a mixed picture, and it may be that it's 4 or 5 days afterwards that they end up with a bit of a mottled skin, it's a bit blue, there's more pain, it's not looking right. And in those cases, we've got chemicals, again, only on prescription, that can help to reverse the agent and eradicate it and basically destroy the filler and get rid of it, which will then restore the blood flow, which will then help that skin get to where it needs to be.
It sounds horrifying, it sounds really worrying.
Unfortunately, if it's not done in a timely manner and that you don't get the treatment at the right time, there can be irreparable damage. So we might not be able to repair what's damaged. You might end up with scar, dead tissue that might slough away, and in very rare cases, just injecting around the lip here, I know people who've actually the artery, the vessels that connect the lip down here also connect up the side of the nose, and they go up onto the top of the brow. So if you inject here, there's a technical possibility that the filler can actually spread up into other bits of the other vessels, and you can end up with whole halves of faces black and part of the tissue being dead and having scar tissue permanently.
So it's permanent.
It can be permanent damage that needs reconstruction by a plastic surgeon and skin grafts, and it's a horrible mess if it goes wrong. So you need to make sure you know who you're going to, and they make sure they know what they're doing.
Can our safe practitioners have certificates or things that we need to recognise?
Unfortunately, the way the UK industry is going is that even people who look like they've got a certificate might not have a valid certificate. Some people, it depends which training course they've gone to, but the public might not be openly aware that the training course they've gone to isn't that good. That's not immediately available. If I showed you a certificate that said I'm certified in something, you've probably got no choice but to believe that I'm certified in something, but that doesn't mean I've got the same level of training as someone else. So I think it's really important to understand their background, to question them, and really, really question them and make sure they know what they're talking about. And if you've got a hint of a suspicion that you think actually this person doesn't know what they're talking about, leave.
I feel like asking you to ask me as if I'm a practitioner pretending I can do this, to ask me the questions we should be asking.
So I would say, what's your background?
Okay.
Where have you worked previously? How long have you been doing this? How many procedures have you done? Have you had any complications? If I had a complication, do you have the correct protocols to treat me and to assess me appropriately? Also, if you've done these treatments previously and you've had complications, how have those outcomes been? You need to really pin them down and ask them questions. Otherwise, you can't just assume they know what they're doing. Unfortunately, in the modern industry, there's just massive, vast gaps in the knowledge bases in some practitioners, and you have to make sure you've got someone who knows what they're doing and gives you the safest treatment possible.
It's such a massive topic, and unfortunately we're coming to the last 3 minutes of our programme, and I'm not sure we're going to be able to do more than what we've been doing here. I think I want to end the programme with some tips from you, but I also wanted to very quickly cover things around skin pigmentation, possibly shadows and bags under the eyes that women, particularly in our communities, worry about. What kind of why do those things happen? And I don't know if you can answer that, but what can we do about those?
Really quickly, because it's a massive topic in itself.
It is, I know. Sorry to throw that in.
With time and aging, as I said, your aging doesn't just occur in your skin, it occurs in your skin, in your fat, in your muscle, and in your bone. Yeah. And around the eyes, there is normally your actual, what we call the orbit, which is the if you look at a skull, it's the actual hole where your eye is. Over time, that actually gets bigger and changes shape. The fat inside that space can pop outwards, give the worsening impression of bags. You get thinning of skin. Sun damage causes damage to the skin as well, and tiredness and lack of sleep,
lack of water,
hydration. All of these things can cause hyperpigmentation in the area, and also being naturally prone anyway, being Asian, we are more prone to getting dark circles and bags under our eyes and stuff. The treatment of which is very, very difficult. And normally it's a long-term thing. Okay,
quick tips, because we're literally coming to the last couple of minutes, and I want you to give some tips on the general.
I think for hyperpigmentation, it needs to be discussed on a case-to-case basis, because the reasons why you have the hyperpigmentation and the eye bags and all of that, it's really specific, and it needs to be treated depending on what's wrong with that particular patient. Did you say you wanted top tips?
Yeah, top tips for just the whole thing about if you're going to be using these cosmetic procedures.
So if you're interested in having cosmetic procedure, you need to be aware that there are risks. It's not a fad. It shouldn't be classed, just as a kind of a lunchtime
fashionable thing to do.
No, it's really serious. You need to know what you're doing. You need to go to the right people. So Google the person, find out what their background is, find out what their history is, research them, look at kind of all the social media outlets and check their credentials and make sure they know what they're doing. Also, I'm not, I'm biased because I'm a doctor, but make sure that you have someone who's got a medical background. You can go to beauty therapist. It may be cheaper for you, but I definitely wouldn't put price on your face. It's ultimately that's what it boils down to. Making sure that
most of these are for your face, aren't they? We're not doing them on our hands.
They are. You can. Yeah, you can do them hand. You can do them on the top of the chest. You can do them all over. But you need to make sure the person you go to knows what they're doing, and more importantly, if worse comes to worse and you do have a complication, you need to make sure that you're in the safest hands possible.
Okay. That's really useful. I wish we'd had more time to carry on, but unfortunately we're coming to the end of the show. I hope that little bit of information has been useful for you. I'm sure you can ring in and let us know if you want any more on it. Please keep us in your du'as. Jazakallah khair. Assalamu alaikum wa rahmatullah.